It's Etch back with another health highlight from Michigan Primary Care Partners and Y102. This week we're going to discuss your A1C level. Now, what does that number mean? Well, it has to do with diabetes. So if your A1C number is too high, then they may be talking to you about pre-diabetes. So what is a healthy number to be at? And also, how can you change your lifestyle, your eating habits, things like that, to make it so that you're less at risk to get diabetes? And that's what we're focusing on this week's Health Highlights from Michigan Primary Care Partners and Y102.
Diabetes is an epidemic in our society because of our high-fat dietary program. Fat coats the insulin molecule and makes it slippery and not work very well, and so we become what's called insulin resistant, and thereby we start to have higher sugar levels in our bloodstream. So I often will challenge people and say, listen, how about this weekend, if their sugar is rising, you have nothing but vegetables for 3 meals a day. Because you come back on Monday and your sugar, whatever it was, will probably be close to normal in 3 days. So you can wake your insulin up immediately.
So a healthy A1C is anything below 5.7. And if you have a A1C between 5.7 and 6.5, that puts you at pre-diabetes. Anything above 6.5 gives you that diagnosis of diabetes. So you really want to make sure you're getting your A1C under control if you're in that pre-diabetes phase, so that you don't get that diagnosis of diabetes.
The rules that the diabetes scientists tell us is that the sugar above 125 on several tests in a fasting condition defines the diabetes diagnosis. I personally don't like giving medications until it's above 200 because I want people not to think that medications are the solution, because diabetes is not a disease of medicine deficiency syndrome. It's a disease of food excess syndrome. And so I really want people to really try to process the thoughts that they can cure this if they will move away from the pork and cheese products. It's amazing how pork and cheese, cancer, heart disease, diabetes, it runs through the gamut. There's not different diets for different people. There's one diet that makes almost all Americans, all human beings better, and especially for diabetes. So moving away from a high-fat diet and try and get that sugar down through that and through walking, exercise, and move in that direction. Then medicines if it's necessary. But I really want people not to have medicines deter them from seeing themselves as the solution to the problem.